Food allergies. Get tested, but it may be food intolerance, which can be overcome by low-carb eating. This is a presentation of the IIQ Metabolic Classroom. Dr. Berry and Coach Shelby present.
For the majority of my patients who feel they have food allergies, I always tell them, listen, you're eating these foods in context with a lot of carbohydrates. So let's improve your diet and get rid of the known inflammatory foods. That doesn't mean that they have allergies to them. That means they're universally inflammatory, and almost always they improve. Now, I do have some patients that truly have food allergies. So again, we don't pretend to be your doctor, and what I would ask you to do is go to your doctor. There are several ways to test for true food allergies. You can do a blood test, and it tests your antibodies against several different food groups. They're pretty thorough. The most accurate test is a skin test, and you can test all kinds of foods that you may be allergic to and environmental allergens through a skin test. So through blood and skin tests, you can figure out a lot of different allergies. There are a couple of gut inflammatory diseases, like Chrohn's disease or ulcerative colitis, that cause stomach pain. And sometimes they're confused for food allergies. So make sure that if you have chronic pain and food is not your friend, that you really get a thorough once-over before you decide you have a food allergy, because it may be an autoimmune disease.
Yeah.
But there's no question that there's a lot of people who are gluten intolerant. And we've actually changed our protocols in our young patients. We used to withhold the 5 food allergy foods, which are tree nuts, peanuts, which are not tree nuts, they're legumes, dairy, eggs, and gluten. And we would hold these until after the year 1 of age, thinking that we were doing their immune system a failure. And some person smarter than I thought, this doesn't seem to be working. And they took a whole bunch of kids, thousands, and half of them, they fed them early, 4 to 6 months. And the other half, they continued in the traditional regimen, waiting until after 1, follow them through the years. And guess what? Turns out that the kids who were exposed to these 5 food allergy groups had many less food reactions to these food groups being introduced to these foods early. So if you're in the population in America, United States, that withheld these food groups, you actually may have a lifestyle-induced food intolerance, having your immune system mature before the age of 1, not seeing these foods. So all the parents out there with young kids, go talk to your doctor about food allergy foods and when to introduce them so that you minimize the risk of food allergies in your children, which cause a lot of inflammation and cause a lot of gut problems.
And we have a lot of people worldwide. We have to remember that depending on where they're from, also have intolerances. I know my brother-in-law, he's first generation American Korean, and he has a huge dairy allergy because his generation or his ancestors ate very little dairy. So when he came over to America, it was really hard on him. So that's another thing. But I have clients come into my office all the time say, I can't drink health code. I'm allergic to whey. It upsets my stomach. And without fail, I tell them, okay, before we completely eliminate whey and think that's the issue, let's first take down the carbohydrates or lower the amount of carbohydrates you're getting, especially those simple sugars, but still have the health code shake. And then let's see how that affects you. It never affects a client. It is crazy. People who think they have just had issues for years with whey have no problem once they eliminate the sugar out of their diet. And I think an allergy is very different than an intolerance, like Dr. Berry was saying. People have intolerances oftentimes due to the high insulin levels, a lot of inflammation, things such as that, versus an allergy is something that's oftentimes more serious, can't just be fixed typically by going low carb. So intolerances I see all the time, I'm sure Emily does and Carly does as well, they completely disappear in a lot of our clients.
Right, and there are some regional places, Asians, African American descent, Hispanic descent may have more likely milk intolerances over European Americans, just from the nature of what they're used to eating. So you may have come with those in your family, but I agree completely with what Shelby said. when you clean up your diet, it's amazing what your gut likes once you get rid of all the other inflammatory foods.
Dr. Berry says, to my patients who feel they have food allergies, I say, you're eating these foods in the context with a lot of carbohydrates. Let's first remove the inflammatory foods you are eating. It doesn't mean you are allergic. Almost always they improve. If you think you have real food allergies, go to your doctor. There are several tests that can be taken. A blood test of your antibodies versus several food groups. A skin test for all types of foods and for environmental allergens. A couple of gut inflammatory diseases that cause stomach pain, Chrohn's disease, ulcerative colitis, can sometimes be confused for food allergies. So, get a thorough checkup. It may be an autoimmune disease like one of these. There's no question that many people are gluten intolerant. In our young patients, we used to withhold the 5 food allergy foods until they were age 1 year. Tree nuts, peanuts, dairy, eggs, gluten. Then a study was done of thousands of young kids. Group 1 fed these 5 foods at 4 to 6 months of age. Group 2 withheld these 5 foods as was typically done until year 1. The results? In the follow-up years, it was found that the kids in group 1 who were fed the 5 foods early had much fewer food allergy problems. So, if you were one who had allergy foods withheld when you were very young, you may have had your immune system mature before 1 year old, not having exposure to any of these foods. And parents, Dr. Berry says, check with your doctor about when to introduce these food allergy foods so as to minimize the risk of food allergies, which cause a lot of inflammation. Coach Shelby says, people worldwide, depending on where they are from, might have food intolerances. For example, she knows of a Korean American who had a history of very little dairy in his family, and so now living in America has high dairy intolerance. She says, many clients say they cannot drink whey protein shake, but she says to them, let's first cut down your carbs, especially the simple sugars. Then try the whey shake and see. The result, she says, they never have a problem with whey. The problem is the high sugars. Food allergy is a very different thing than a food intolerance. People often have food intolerances due to high insulin levels and high inflammation, compared to an allergy, which is more serious and can't be fixed just with low carb. But, she says, we see food intolerances often completely disappear. Dr. Berry summarizes, people of Asian, African, and Hispanic descent may have more milk intolerances. It is amazing, however, how much of this goes away when the diet removes carbohydrates and lowers inflation.
Annotated, summarized, easy to share with loved ones.